Welcome students to week three. Week three, we're going to be covering general interventions and theoretical approaches to sexuality counseling. And so since we don't have a Zoom meeting, we're going to be covering some of the material in this video, and I'm going to post some resources below for you to continue to take a look at and learn from and all of that stuff. So to start off with, we do have two chapters that we're going to be reading this book. We're going to start off with the Mary book, which is chapter 3, and the title matches the title of this week, General Interventions and Theoretical Approaches to Sexuality Counseling. The quote at the beginning of the chapter says, "The way we commonly think about how intimacy and sex work in marriage is only part of the picture," which is true, very true. And so we're going to be learning about that this week. What the chapter starts off with is talking about some general guidelines to sexuality counseling, and this is really related to any kind of counseling, so this wouldn't be specific to sex therapists. So these would cover our work with clients as well. Making sure that we're using assessments as necessary, incorporating things into treatment planning, that we're referring to medical evaluation as needed, and again, making sure that we're paying attention to our scope of practice and not trying to reach outside of it. Be as comprehensive as possible. Include other people in the counseling as the individual deems necessary. So it may mean if you're doing individual counseling, you might incorporate a partner or partners into the counseling room as well. Address sexual satisfaction as well as problems, and this is one of the things that you kind of learn about in marriage and family counseling, but really is true across the board. Let's not talk about just the things that aren't working, but let's talk about the things that are working, right? Look within the frame of developmental context, which we do talk about in one of our discussions this semester about developmentally, like where do we feel like we fall or have fallen in our lives. Apply the common factors framework. So that's about like making sure that we're using the common factors framework and counseling within the scope of this. It does have a case illustration on 77 that talks about applying some of these general guidelines to this couple that comes in for counseling, and has some reflection questions associated with that to help your learning process. And then it goes over some reviews of approaches to sexuality counseling. So what are some ways that we can start to intervene, which does include medical treatment, right? Kind of referring the client out if necessary, and continuing our work in our communication with the medical provider. It goes into some cognitive behavioral therapy interventions, which can be really helpful for a broad range of clients, and so they work well with many clients, and so that's why they tend to be a common one for clinicians to go to. It goes into other integrative and theoretical approaches such as psychodynamics, social constructivist, postmodern approaches, experiential, systemic as well. Talks about specific treatments that are tailored to, or treatments that are tailored specifically to certain dysfunctions. So things that can be done directly related to male erectile dysfunction, male orgasmic disorder, premature ejaculation, female pelvic pain disorder, hypoactive sexual desire disorder, hypersexual behaviors and sexual compulsions, dysfunction related to medical side effects. You might see that pretty common in those clients who are taking psychotropic medications for their mood disorders or anxiety disorders or other things. Also treatment for postmenopausal women, because there tends to be some issues there sometimes with the physiological functioning. Treatment for infidelity, which of course you learn a little bit more in your couples and family counseling. Treatment for sexual abuse survivors, and sex offenders, which we also get into later this semester as well. Treatment for former prostitutes, those involved in sex work. Treatment via the internet, which is becoming a big topic. I mean, it's kind of trended in that direction anyway for a couple of years, but now even more so with the state of the world. And treatment with sex surrogates, which is an interesting topic. There's a movie called The Sessions that came out quite some time ago that is based on a true story about an individual who uses a sex surrogate. And so that movie can give you a little bit of an idea of what sex surrogacy looks like. Of course, it is a movie, and there are parts that aren't totally accurate, but can give you an idea. Next, it goes into treatment outcomes in sexuality counseling. And at the end of the chapter is a guided reflection activity, current comfort and competence to provide sexuality counseling interventions, which is a good way to kind of test yourself on how you're feeling now. You can come back to it at the end of the semester and retest yourself, see if that's changed. Also come back to it, as you finish the program and you're kind of been in the field for a little bit, stuff like that. As always, these chapters end with a summary and kind of some keystones, additional resources that you can look into. Connected with that is the chapter we're going to be reading from Bueller, which is the evolution of the field of sexology, which sexology is simply the study of sex and sexual health definition. So it gets into a little bit more of the historical perspective and looking at some of the front runners in doing this research, such as like Kinsey and Masters and Johnson, which you may have heard of Kinsey and the Kinsey Institute, which still exists today, and some of the work of Masters and Johnson's, which was popularized by Masters of Sex TV show. I think that's what it was called. It was a series. And then there was also a relatively recent movie, I think, on Kinsey. And then it talks about, even as the research continues into the current day, it talks about the specific scholarly definitions of sexual health from a number of different resources, the World Health Organization and all of that. Different risks to sexual health that we may not always think about as being directly connected, but diabetes, cardiovascular health, urinary tract disease, pelvic floor dysfunction, cancers, psychiatric, psychological features, medications, and also recreational drugs, infertility, phase of life issues, such as the birth of a child, retirement, menopause, all of those wonderful things, and vocational problems, and the way that all of those can be impacting sexual functioning. And so those are things that we need to be addressing with clients and potentially even having them referred out to deal with. There's also relational factors that are an impact, or that can have an impact. Intimacy, being fully present, communication, all of that is covered. The sexuality of the therapist as well, and kind of what we're bringing into the room. And again, as always with chapters in this textbook, there are takeaway points. There's some activities that you can engage in to help further your knowledge and education experience that are really awesome to look at, resources and references. At the end of this chapter, it does have the Declaration of Sexual Rights, which is really important for us to look at because, we want to make sure that we're addressing our own needs in that way. I'm talking about the clients here. And so making sure that your clients are, recognizing what rights and things that they deserve, right, as human beings. Then it also has another one about how to use a condom consistently and correctly, which obviously plays into sexual health as well. And so again, these are things that you could even photocopy or scan in and send to your clients if they're in need of this information. Some of the activities talk about, thinking about these potential little cases, that how you might approach them. Cultural impact on the definitions of sexual health is really important. And those of you who had the cross-cultural course, there may have been some of that you learned there. And how might you define sexual health? So lots and lots of good stuff in our chapters for this week. Attached with the module information is the PowerPoint for the Bueller chapter, and also the resources from Bueller. So it's all of the resources in this textbook all in one spot so that you can easily use them with clients. This week we do have our first quiz, and that is going to cover all of the material from the first 3 weeks. It's primarily going to focus on the Murray, Pope, and Willis text, but some of it is also going to come from the Bueller textbook. You're going to see the announcement that has all of the study guides so that you can look at those and have a good idea of what's going to be focused on in the quiz. And then we have our podcast discussion for this week. And so with the podcast discussion, there are 3 different podcasts listed that you can take a look at. Sexual abuse in general, but childhood sexual abuse is something that we're going to cover a little later in the chapter. But we do have 2 podcasts covering that this week, Surviving Childhood Sexual Abuse and How to Talk About Childhood Sexual Abuse. And then the 3rd podcast is Tantric Sex and Sex Surrogate. And so that goes a little bit more into that topic. And so you can choose one of the 3 of these, 2 of them. You can definitely listen to all 3. They're relatively short. I think about half an hour most of the podcast. And so discuss what you learned, how it relates to the readings for the week, how you feel this will impact you as a clinician in your work with clients, and what more do you feel like you need to learn. Your initial post is due on Thursday. There will be an announcement that comes out bright and early Thursday morning to remind you to turn it in. And then you have to reply at least one substantial reply to peers, but you can definitely do more. Substantial posts are following the ABC method, which is included in your discussion prompt. The ABC method is A, acknowledge, so acknowledge the contributions of the person with whom you're responding. B, build on the ideas of the original poster. And C, contribute in some additional way by asking questions, or adding some resources and things like that that could be helpful to your peers. And so that is it for this week. Below this video, you're going to find lots of wonderful resources to look into, some things that we would be covering if this were a face-to-face course. And so use them, take a look at, learn more about what you're interested in. And otherwise, I hope that you have a great week this week, and I look forward to seeing you next week in our second Zoom meeting. Thanks, guys.